Hey, my name is Courtney. This is Jessica, Taylor, and Cassidy, and today we're going to be providing the oppositional rebuttal as to whether or not a nurse with a history of substance abuse should be allowed to practice nursing. The affirmative side stated that there are alternative discipline programs out there rather than revoking the nurse's license, and while the ANA recommends this, a study by the University of Tennessee found that there are still 6 states that have not complied with this. So if a nurse really wants to practice, they would have to uproot their families and move away based off this varying law.
According to the Americans with Disabilities Act, in order to have a disability, a person must be substantially limited by their ailment. The article states a person who casually used drugs illegally in the past but did not become addicted is not an individual with a disability based on the past drug use. In order for a person to be substantially limited because of drug use, he or she must be addicted to the drug. The individual then must successfully enter and complete a rehabilitation program in order to be covered by the Americans with Disabilities Act.
So it was stated that nurses should use these alternative to discipline programs. However, we need to look at the overall cost of these programs. With 300,000 nurses annually being diagnosed with substance abuse, that could lead to a $750 billion annual cost. And according to a 2016 report from the Department of Defense, depending on which program you choose, cost could reach up to $15,000 per nurse. And according to the Hazelden Betty Ford Foundation, which is a more specific alternative to discipline program, it was stated that their program was actually funded by nurse licensure renewal fees. So it is actively being taken away from our pockets as nurses.
So these alternative discipline programs that Cassidy was just talking about are used in many states instead of revoking licenses. These programs include treatment and monitoring when returning to work. The problem with this is that nurses and nurse supervisors become responsible for monitoring the nurse with a history of substance abuse. This takes away from nurses and the patients, which leads to a decrease in patient safety, which is our priority in nursing. Not only does this hinder the patient's safety, but it also hinders the relationship between the nursing staff. There is no sense of independence. The trust amongst the nurses has been disrupted, and now the sense of teamwork has been affected as well. This all puts the patient at risk, which is our main concern.